Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Kishore KV. He is a highly accomplished neurologist, epileptomologist, and currently practicing in Bangalore. He has a brilliant academic career with a gold medal, and he was trained in the prestigious NIMANS and also has got MRCP from United Kingdom. He got his postdoctoral fellowship from NIMANS, and he is a very popular person and started Spike and Wave social media. Today he is going to tell us what is the difference between Parkinsonism and Parkinson's disease and why we get it and what is the how to manage everything he is going to tell. He is an expert. Let us listen to him. Welcome, Dr. Kishore.
Thank you. Thank you.
Yeah. Please tell us what is this Parkinsonism and Parkinson's disease?
Yeah. So basically, Parkinsonism is a constellation of symptoms, 5, 6 symptoms, in the sense slowness of activity, thought process, speech, hand activities, walking, and tremorlessness of the hand, that is shakiness of the hands.
Tremors.
Whether, yes, tremors. And whether they are sitting quietly, the hands keep shaking, and also while doing some activities. And also rigidity, that is stiffness of the hands and legs. Yes. And freezing episodes, in the sense they become like a
statue.
doll. Yes. And postural instability, that is imbalance. They are not able to maintain the posture. So
and
these are all
they take small steps and start walking because they don't want to fall down. Very cautious.
Yes, exactly. Exactly. So these are all the symptoms. There are many other symptoms, but these are the main symptoms which has grouped into Parkinsonism. And what is Parkinson's disease? So the Parkinson's disease is like idiopathic Parkinson's disease and atypical Parkinson's disease.
Because there we don't know the cause of it.
Yes, yes.
Yeah. In Parkinsonism, we know the cause. So what are the causes there and why we have the difference?
Yeah. So in Parkinsonism, there are a lot of causes. In the sense, most commonly what we see in our daily practice is the medicine induced many a times when they are on psychiatric medicines for long time, it can cause Parkinsonism. And certain gastric medicines can cause Parkinsonism. And many of the other medicines also can cause when they are taking for a long time. And other than that, if there are any space occupying lesions like
tumors or cancers or something,
yes, in the brain. And if there is any stroke, in a strategic stroke in certain areas of the brain, can also cause Parkinsonism. Other than that, the idiopathic Parkinson's also, which is a degenerative disease, that is also one of the cause for Parkinsonism.
Now, between the two, which one is treatable?
So, Parkinsonism, for example, if it is caused because of any medicines, once we stop the medicine, generally it reverts back.
Okay.
Yes. And if there is any tumor, space occupying lesion, if surgery is done, it will be, they will become better. If it is vascular Parkinsonism, we have certain medications and to prevent further strokes. And IPD, that is idiopathic Parkinson's, also has certain medications to improve the symptoms.
Okay. Now, family members, how should they realize and when to bring them to the doctor?
Yeah. So Parkinsonism is overwhelmingly common in elderly age group. So family members should keep observing them, their activities. For example, it is as we grow old, obviously slowness and all those things are part of aging. But when we compare the age group, when they are in their peers group, so if they are becoming too slow compared to others, or if there is any tremors or shakiness of hand, and they are not able to go out and carry out their activities, and they are repeatedly falling, and they are not able to move around properly, then they need to seek medical attention.
Okay. Now, once they come to you, how do you make the diagnosis? What are the investigations?
Yeah. So they when they come to us, we take a detailed history. What are the major symptoms, minor symptoms, and non-motor, any
Hmm.
other things are there. We'll note it down, examine in detail what systems are involved, then have a thought process as a provisional diagnosis,
Hmm.
and go for scanning if not done previously. So
Okay.
usually we do MRI to look for any visible abnormality like any
Okay.
tumors
Hmm.
or any strokes in the past, like that. Generally, we do the scanning and start them on appropriate medication based on the individual patient.
Okay. When you said appropriate medicines, what are the recent advances and what medicines are there? And how much improvement do they get?
Yeah. So in IPD, that is idiopathic Parkinson's disease, so we give levodopa, medicines, which
Medicine, yeah.
will, yeah,
Just
it
to
is a medicine.
supplement, that is supplement, already the brain has got the deficiency, so you
Less.
are supplying. Okay.
Yes, yes, supplying. For
Hmm.
few people, it works wonders in the
Hmm.
sense,
Hmm.
without that, they are like a doll, very difficult to move robot.
Okay.
And then with that, it will be like, full, they are able to move around very normally. And it's a
Yes.
drastic change. And, they keep the medicines with them
So
all the time.
the
So,
patient himself will know that it is
yes,
required and then they'll swallow. Like how
yes,
these
yes, yes,
diabetics, when they are getting hypoglycemic, they just put a chocolate or something. So these
yes,
people
yes.
also, they learn very smart. Okay.
Yes, yes, they know, sir. Medicine has worked very well, like that they will tell. So
Hmm.
for them,
Hmm.
as the day progresses, they need more and more dose to get the same effect.
Okay.
So
Okay.
then what we do, as the dose increases,
Hmm.
lot of side effects of levodopa induced
Also will be
dyskinesias
there.
and all
Yes.
will be
Yes.
there. So then after few years, if the side effects are too much more than the effects,
Hmm.
and also based on many other factors,
Hmm.
now the recent advances, we call it as DBS, deep brain stimulation also, we
Okay.
will assess
So
them and
you
offer
are
them.
stimulating the brain. So how do you do it?
Yeah, we put electrodes in a specific region of the brain,
Okay.
based on the individual patient
Hmm.
characteristics,
Hmm.
and stimulate them continuously
Hmm.
over few weeks, months, and years.
Is it
And
like a shock or something?
a small amount of currents will be given so that
Okay,
it
okay.
changes the
Yeah,
uh,
electromagnetic waves and okay.
yes, yes, it will have a change in the biochemical parameters in the brain, and also once it takes effect, it will take some months, and then slowly will increase the current and other parameters and reduce the medication so that effects are there and side
Okay.
effects are reduced.
Okay. So you balance the side effects and then get a better results. That is very
Yes,
nice.
yes.
Is any surgery is done? No, no. Only when there are tumors.
No, this DBS we consider as
As a
a
surgery only.
surgery.
Okay,
Yes,
okay,
yes,
okay,
yes.
okay. Surgery.
This is not for everybody. This is not a curative surgery, but
Okay.
it has helped many, and it will based on specific individual patients only.
Okay, 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 sir. So ultimately, what are the, is there any way of preventing this Parkinsonism? Because the
Parkins.
lifestyle has changed nowadays. And then, so whether our habits are going to cause or anything like that?
Usually, what we tell them is in the early Parkinson's
Hmm.
disease,
Hmm.
we don't give them pharmacotherapy, no medications. We tell
Hmm.
them to be very physically active and then
Okay,
carry out their activities. So,
okay,
same hold good for other people also. When we
okay.
are physically active and mentally active, many
Hmm.
of the diseases can be pushed
Yeah,
way forward.
further away,
Yes,
so they can postpone getting that disease by being
yes,
active.
yes,
So regular
yes.
walking, exercise and activity and creativity all are very important to ward off this thing. So
Healthy
why,
food.
yeah,
Yes.
yeah, what do you mean by healthy food?
So lots of vegetables, fruits, and whole grains,
Hmm.
less packed foods. So these are all considered as a healthy options.
Okay, okay. By that, you can postpone getting the Parkinsonism.
Yes.
So thank you very much, Dr. Kishore, for explaining so well about the Parkinsonism and Parkinson's disease, the difference between the two. Thank you.
Thank you. Thank you for having me.